management teaching. You're welcome to another edition of my program called Health Talk with Queen Nikki. Our topic today is going to be pain management in nursing perspective. Okay, so now when we talk about pain, but before I go, don't forget, subscribe to my YouTube channel, TikTok, and also my IG, all Health Talk Queen. Okay, now let's go into today's topic. We are not wasting time. So what is going to be our topic today? Like I already said earlier, is pain management teaching in nursing perspective. As a nurse, whatever the patient said the pain is, that's how we're going to treat it. That's what the pain is going to be. Treatment for pain is gonna be. So, but what are the non-pharmacological things we can do at home or wherever we are that we can manage our pain? This is just mild pain, not chronic pain like cancer pain or acute pain. It's just a mild pain. Pain like menstrual cramp, headache, general body pain after working long hours. This is the pain that I'm talking about, and other pains. So let's go right into it. Number one is exercise. Yes, I always talk about exercise in all my video because that is number one thing that can help us to minimize pain and also other disease process. So exercise. Now, when we talk about exercise, there is one exercise that I want to emphasize when we talk about pain management. This is deep breathing exercise. Deep breathing exercise helps to relax the muscle. And there are various ways we can do deep breath exercise. But there is one particular one that I do after working long hours, like 14 hours, sometimes 16 hours. I do this to help me relieve my pain, especially on my legs and my, back area. So this is what I do. And I'm going to demonstrate it. It's called deep breathing exercise. So I take a deep breath in a quiet place. I just do this. It helps. Not only will it help you to focus, it also helps to expand the lungs and also to relieve pain. The next one is yoga exercise. If you are looking for yoga exercise video, go to my TikTok. You will see a lot. It helps to relax, to calm your nerve, to make you focus. So it's one of the biggest pain relief exercise that you can do, and this you can do it at home. You don't have to go to gym. The next one is relaxation and massage. Massage is a good form. You can go to massage shop and get it done, or you can just tell your daughter or your son or your spouse to do massage on you. It helps to relieve pain. Okay, and also whosoever that can do it in the affected area or your general body. So it helps really good. The next one is meditation. Yeah, meditation means you stay in a quiet place and you meditate some words. Yeah, it helps. If you want to look for those, go to YouTube. They have a lot. You keep repeating the same word over and over again. It takes you to another realm and it makes you, forget about the pain. The next one is distraction. Yes, we do this a lot. If somebody is having mild pain, you can easily talk to that person and say funny jokes or anything that can distract the person away from the pain. Okay, this is mild pain. Remember mild pain. Another one is look for what the patient loves to do. If it's music, if it's art, if it's talking to a cool friend, so do it. It also helps in distracting the patient away from pain. The next one is heat or cold. There are some pain remedy that they usually sell in Target, Walmart, CVS. It's called heat pack or cold pack. Whatever works for your body. This is also good for sickle cell patient and also patient with acute pain too. You can buy the part. If the heat work for you, buy the heat pack, put it in the affected area. It helps to relax the nerves area. Okay, so or if it's the cold one, it helps also. If you have children that hurt themselves and they have swollen ankle after you've discharged from the hospital, you can use either the heat or the cold. But if you are using the heat pack, please make sure you wrap it in a towel so it doesn't burn the a baby in the skin. Okay, very important. Safety, safety, safety. Always put that at the back of our mind. Okay, so whatever. And also cramp. I did video about menstrual cramp. You can also use heat pack to put it in the abdominal area. That can help. So whatever work for your body, use it. The next one is warm bath. Yes, warm bath relaxes the pain in the body. I talked about depression, and in my live stream I mentioned about putting yourself in Lysol salt, like in the tub bath, or any relaxing thing that they usually put, in the water, or just take a warm bath. You don't have to put anything. Take a warm bath, soak yourself in the tub bath, you understand, and just sip your little wine or your little red wine, okay, or your little juice or water. If you don't drink juice or wine, you can just put and relax. Play soft music at the back of the shower area. It relaxes the muscle, it relaxes the spirit. Okay, so you will distract you away from the pain. So warm bath is very, very good, especially during menstrual cramp, or during maybe you've worked long hour, or you're stressed, or you depressed, or you have anxiety. So these are the things that you can use warm bath for. Or you're having chronic headache, like when you have headache after maybe a couple of stressful work or events. Just remove your wig, or just remove your hair, and then put the water down into your skull. It helps it to relax the muscle, relax the body system. So warm bath is very good, especially when you let the water or the shower water run from your head down to your toe. Very, very helpful. The next one that I have here is physical therapies. Now, I said non-pharmacologic. We are going to physical therapy. There are some pain that there's nothing you can do but just to go to physical therapy, and this is your doctor's recommendation. You have to go to the doctor. Maybe you've tried all this non-pharmacology, nothing is working. Talk to your primary care doctor. They will refer you to a physical therapy or a pain management doctor. They have doctor that all they do is pain control. So they will help you. Your insurance have to cover it though, and you have to have a reason why they are referring you to that particular place, and then they will help you. Physical therapy also can help with mobility and other stuff. Okay, so but this one is as per doctor recommendation. They will help you to manage your pain and also your physical mobility. The next one is medication. I don't love to mention medication on my program, but there are some over-the-counter medication that you can get in United States or Western world. Medication like Motrin, Tylenol, things like that is over the counter. You don't need doctor prescription for that. You can use that when you've tried all this non-pharmacology, nothing is working. Just go ahead and use all those Tylenol over the counter medication. Now, let's say you've used that and it's still not working. Please call 911 or go to your nearest emergency room to get it checked out, because sometimes it might be like, I'm just giving an example, it might be like appendicitis, it might be ovarian rupture, it might be different things, so it might be an emergency. Please don't waste time. Go to the nearest emergency room to get it checked out. So make sure that it's not acute thing or something that is benign that you are not aware of. So this is very important. And then the next one is positioning. Yes, positioning helps sometimes. If you're having pain maybe on your left side, turn to your right side. If you're having pain this is very good for pregnant women too. Sometimes they are very uncomfortable. Change position here and there to your own comfort. Okay, so I hope this helped. But regardless of any method that you use, remember one thing: your pain management have to do with your psychological thinking, the way you think about the pain, and that is the way you will treat the pain. Okay, and it starts from you. Self-care. Take care of yourself. Till I see you in my next video, remain blessed, and remember, continue to watch my video, and thank you for sharing. Bye and God bless. Bye bye.